And now I will pass on the word to you, Beat, so that you can offer us a brief introduction about yourself and some background.
Yeah, thank you very much, Carla, for your invitation and for organizing this today. It's a pleasure to see so many people coming in and that there is so much interest in the model and hopefully also in the training. Yeah, and I would like to introduce myself, but just one thing that I want to ask you, when you want to put questions in the chat, please address them just to Carla and Ola. Ola is my assistant. She will be assisting in the Portugal training, and she is assisting also in other trainings with me. That's her. So I won't see your questions while I'm talking because this is a bit too much, too destructive for me. Yeah, my name is Beate Leissse, and I'm a psychiatrist and psychotherapist. So my background is a medical background, and I have a psychodynamic approach that I learned in psychotherapy, but I'm also trained in EMDR and somatic experiencing and biodynamic cranial. So just to talk briefly, to say briefly a little bit about my personal background, and I had a private practice for more than 20 years after my clinical years. So there is a bit of experience here. And for me, NARM was a very a very crucial part in my development, actually something that I was looking for in my private practice, because I don't know how you work, but I had a lot of clients with developmental trauma, presenting them, of course, with their symptoms of depression, anxiety, or OCD. And I was always looking for some method to be more able to address these difficulties these people were facing. So this was actually the point where I was looking for more than just psychodynamic approach, because clients, patients were always saying, I understand, but I can't, that doesn't seem to help me, my understanding of what my problems are. So that's where I came to look for how to introduce and how to integrate the body into the work, which made me looking for other methods, trauma-related methods, just like EMDR and later as somatic experiencing. And that's where I met Larry back then in 2008, when he still was an SE teacher. And this was very intriguing to learn how to work with the nervous system. And I think some of you are familiar with that. You maybe have also body-oriented approaches that you've learned. And this was very important at the time. And at the same time, I was always asking myself, but how to address shame and guilt, which was not possible. Larry was able to make it in his demonstration sessions, but this was not quite SE, but something else. And that was, for me, the missing link. And when he then later offered the NARM training, I started. And since then, I'm just doing that and nothing else. So coming to NARM, you are here because you're curious to hear a little bit about the method, and you might be interested in the training as well. Of course, it's not so easy to give a sufficient overview in 1 hour, but at least I can highlight some things and give you a glimpse of what this is about and how it differs from other methods. As you all know, there is this differentiation today between the PTSD and the complex PTSD. You heard about this? Yeah. And I guess you're all familiar with the diagnosis of PTSD and the characteristics that are hypervigilance, flashback, and avoidance. And in addition to that, in complex PTSD, you have this low self-esteem, the difficulties to contain and to regulate emotions, and the difficulties in relationships. And this was a very huge and changing point when this was acknowledged. Unfortunately, not for the DSM, just for the ICD-11. So that there is finally a possibility to diagnose, not just to diagnose as we needed before in relating into describing symptoms, like for anxiety or psychosomatic problems or depression, but to name where this is coming from, like to name the source of the suffering and not just describing the symptoms. And there is this very important differentiation between shock trauma and developmental trauma, and I can't go into all of the details, but just to say that shock trauma is a one-time event that has a clear beginning and a clear end, and what we address when we work with shock trauma is the working with the nervous system and how we can complete the so-called fight-flight response. I guess most of you are familiar with that. And in a differentiation to that, when we talk about complex post-traumatic stress disorder or developmental trauma, which is not quite the same, but developmental trauma is basically complex trauma, then when we talk about developmental trauma, we talk about trauma that has no clear beginning and no clear end, and is not a single event, and it's not extraordinary, but it's a daily life experience. And it's relational, and that's the huge difference. And this is what is addressed in NARM. Actually, these three additional symptoms that were described in the complex PTSD, like the difficulties with emotions, relationship, and the low self-esteem, is exactly what we address in NARM, the NeuroAffective Relational Model. Means that we in a relationship, in a therapeutic relationship, we explore and we look of how clients are organizing their internal world, meaning what are their assumptions, what are their judgments, how they think about themselves, and how that shapes their emotional life and how that shapes their relationships. What NARM not is, maybe it's also good to say that, NARM is a method that is not reductionistic, not pathologizing, not cathartic, non-regressive, and this is very important because in many modalities, we just address a part of human experience, which in a way is reductionistic. Like if we just look at the neurobiology, if we just look at neurotransmitters, or if we just look at behavior, or if we just look at a person's history, this is always a little bit reductionistic. And so we want to address the whole range of human experience, meaning what people are thinking about themselves, how their emotional life is, how they organize their internal world, how they organize their relationships, and what are the difficulties that they're struggling with. in that sense, NARM is also not goal-oriented, because we don't want to make symptoms just go away, which is, of course, something, I don't know how it was for you, but for me, this was so naturally when clients were coming into my practice and suffering from various symptoms that, of course, my immediate impulse was to somehow try to help them to get rid of their symptoms, or to improve, to get better in regard to what the symptoms are about. Cognitive behavior therapy, that we just focus on symptoms and on symptom reduction without asking what is it that these symptoms are wanting to communicate, what is it that is driving the symptoms. Yeah? Because we also assume always that there is a reason why clients are presenting symptoms, that these symptoms want to communicate something. Of course, what is communicated then is something that is about the internal conflict, which we can explore, which we can examine with them, which we can look at, and which we can deconstruct with our clients. That is the main process, what we do in NARM. So let me see what is important. So what is important when we talk about NARM, and what is so maybe attractive to do a NARM training, is that it's a method where you, as therapists, don't have to effort that much. So this is what all therapists in all countries have in common, is that they all effort way too much, and they all try hard to make symptoms going better, and making their clients to reach some goals. And this is not necessary. So, and when we are no longer goal-oriented and try to get hard to a certain place with our clients, then we can relax and we can lay back and see what the clients are presenting is about. And then we can make it a co-work with our clients to see how come that I'm having these symptoms. And just instead of making themselves wrong, something's wrong with me that I'm having these symptoms. And this is a very different approach. The basic assumption in NARM is that there is this driving force in everybody, what you call the life force, or what in other traditions is called the chi or the élan vital. So that this is always there and is trying to grow towards healing and connection and more organization. When we really trust in that, and when we take that for serious, we don't have to try to make change happen. Then change will happen the moment when there is no longer an obstacle for change. And this is a very different view on all the suffering of our clients. So maybe it's also good to say something about the roots of NARM, because NARM, of course, is based on other approaches that is not very new, something you might know. So it's psychodynamic based, but it's also based on bodily oriented methods, and it includes also non-Western oriented approaches. And these elements in themselves are not such a new thing. And all the theory is not something that is so extraordinary. But the way we combine our understanding and how we address the whole picture and how we put that in a clinical model, that is very different from every other method so far. So there is, in every method is also a meta-communication. So when you address in a psychodynamic therapy, for example, when you always address history, the client's biography, and when you always explain what happens in the here and now is because that and that happened in the past. And I'm simplifying a little bit, I know. But then the meta-communication is important is what happened in the past and not what happens now. Or if you always focus on behavior, then clients also become good in focusing on behavior, and they might have the belief what is important is the behavior and not how I'm feeling. And when you always focus on bodily sensations, then client may become very good in tracking their bodily sensations, but maybe ignoring their emotions. And this is the tricky part, that when we focus on one part, that we risk to miss all the other elements of human experience, which is so important. And that's also the challenge in NARM, to hold the whole picture. And when we as therapists, when we are too much focused on one part, we are not able to see the rest anymore. That's the risk. In addition to that, when we start effort, we are no longer relaxed. Our sympathetic nervous system goes online. We are under stress, and then we are no longer connected with the other person. So we are no longer in a relationship because we're more occupied with our internal distress and our own goal than with our clients. Some of you may also be familiar with the polyvagal theory of Porges, and I know it's questions not once in a while, but there is something in clinical, when we see this in a clinical setting, there is a truth in it. When we as therapists, when we can be really relaxed and laid back, then we are much more present and open and more receptive than when we are under stress, then we are no longer available for our it's only the German word that comes to my mind. I'm apologizing for somehow it's not so easy in English. When I'm not used to it. When I'm in the trainings, then it's better after a while. But for the other person, let's say, we are not so available for the other person anymore. And these are the things that we look at in NARM. Actually, Larry Heller developed the NARM approach to protect clients from therapists' counter-transference acting out. This was actually the main interest that he had back then. And the good side effect is that when we develop in our NARM capacities, then we as therapists don't effort, and work becomes much easier and more effective at the same time. So this is what makes NARM so different from other modalities. And it's also the relational part in the therapeutic process that has much more weight in this modality than it often has in other modalities. I don't want to say it for every modality, that's probably not true. And it also differs from person to person. It might be very different for every therapist. But what we want to address in NARM mainly is what is happening in the here and now in the relationship with my client. What is presenting in how they learned to relate to another person. Because this is developmentally primed. So that's what we learn in our early years, is who we are, how the world is, and how relationship functions, and what it is that we have to do in order to keep relationship and to be in relationship. So everything, every material, everything that is necessary is there in the moment. And that's what we want to address as much as possible. That's what we call the working in the here and now. And I also already said that we don't want to work goal-oriented. And this is also a little bit challenging sometimes, because of course clients will come into your practice because they suffer from symptoms and they want to get rid of them, which is understandable. Yeah. And often they come in your practice with this understandable wish, I want to get rid of my symptoms, and this idea something is wrong with me because I'm suffering from that symptom. So I am coming to you in order for you to fix me. And when you as a therapist, or when we as therapists with the best intention try to help our clients and starting to work on the symptoms and trying to help them to get rid of their symptoms, on an implicit level, we are reinforcing this message that they're already sending to themselves that something wrong with them. So then there is this idea, I need to change, something wrong with me. And when we then try to help them to change, we are reinforcing that. And we don't want to do this. Rather than reinforcing that message, we hear that, okay, I hear you, I hear that you want to get rid of your symptoms, and I understand that. And of course, we can't promise results, but what we can promise, we can look what these symptoms are about. We can explore together what these symptoms want to communicate. So, and that's what we can offer in NARM, a process-oriented exploration, which then develops in the relationship ongoing. And this is what people can learn in the NARM training, the clinical skills and the personal development to be able to stay relaxed and to develop the trust that this is working without me as therapist doing. And that's a challenge sometimes. Yeah. Okay, pause.
I do have a few questions here, Beate, if you want me to.
Okay, yeah, maybe we
will
can
allow you a few moments. So someone asked if you could say, how does NARM implement working with the body and the nervous system? Yeah.
So how we implement the working with the body and the nervous system is that we, when we're sitting with someone, we resonate, of course, and we pick up what happens in the body, in the resonance. And of course, we use our own bodily experience to pick up, and we see, of course, what happens. And we may reflect that back. Without interpreting it, without telling a person what they are feeling, but to just describe what happens, and then to ask. So I see you're taking a deeper breath. I see you having tears in your eyes. I'm wondering what's going on for you. Just like that. Without assuming that we know what's going on. This is important. And this is the relational part. We want to meet someone as much as possible on an equal level. Of course, it's never quite equal, because there is a person reaching out for help and then coming to you and they are telling you their story and you're not telling your story. So it's not equal. But it is as much as possible, because we don't want to impose that we know better than our clients about their internal world, which we don't. And that's how we pay attention to the body and to the nervous system, and we pay especially attention when there is something happening that is in the direction of more organization, more aliveness, more expansion. This is something we want to reflect back so that clients can become more aware of that there's something happening, and that they can learn to tolerate the more expansive state, which is more challenging than to be with the suffering that they already know for so long. Yeah.
And so another question here is, what are the roles that emotions play in NARM?
Yeah, the emotions are crucial in NARM, and emotions are always relational, and they communicate something. We always want to know what's the message of the emotion, and we want to help our clients to stay present to their emotion, that they don't have to act them in or to act them out, but to be able to contain. And that's why we say NARM is a containment model and not a regulation model. So we're not going to regulate the emotions for them, but we help them to stay present to the emotion, which is also always, it's a psychological, but not just, it's a psychobiological capacity. So it also needs a nervous system and a body that is able to contain the emotions. But you can imagine for a little child, it's difficult sometimes to contain very strong emotions. But adults in general, they can. But for some reasons, they may have disconnect from their capacity, or they're not used to use it. Yeah? So that can be challenging. So this is, and to have access to the full range of emotions, which is so important, that we don't have to reject any emotion. This is something that we want to support in now. So we always, when we talk about emotion, and there is this part of emotional completion, which is very important, that is something that we will address in the training. We always look, what is the emotion that is missing here? What is the emotion that a person don't have access to, that they avoid, or that they are fearing? So many people, you may know that, tell you, I never feel anger or rage. This is something very unfamiliar for me. But that tells us just that they're too afraid to feel it. That it's too scary for them to connect to it. Or people will be scared by feeling vulnerable. That's another possibility. So they avoid vulnerability. And we don't want them, when we are aware of the emotion that is missing, we are not going to bring people into their emotion. This is because this would be goal-oriented. We don't do that. But we look with them how they try to run away, and we try to help them to see how they run away from themselves and from their emotions, because there is a conflict. And on the other hand, they want something for themselves. When they want to, like, let's say, feel more relaxed in relationship with other people, then we look with them what's in the way for them to feel more relaxed in relationship with other people. And then sooner or later, these emotions that people are running away from, they will come into play. And then this is how we relate to it. And we say, okay, you want this, and that's what you're doing. And let's see what is happening here. And what's so scary for you to feel your anger, or to allow yourself vulnerability, to show up vulnerable. Okay.
And do you, in the therapeutical relationship, So if someone is activated by some of the emotions that arise, do you offer resources for them to regulate? Do you help them to find their own resources? How does that happen?
So we don't use the word activated. So when someone is telling us, so I feel activated, I'm always curious to know, and I would ask back, so what is it that you're meaning? What do you mean when you say you're activated? So what feels intolerable here? And then again, we will come to the fear of the emotion. What's so scary? Yeah. And in talking about what's so scary and looking at that, of course, then there is some distance happening. Yeah. But then we still have the exploration of what is so scary instead of just regulating something away, which on one hand is not useful because we regulate away the material of the work, so which is not very useful in the end. And it doesn't change anything, because the next moment, the next situation when this person is triggered, so to say, it will happen again.
So someone is asking, so how does NARM deal with guilt and shame? What is the approach and what makes it so special for you?
Guilt and shame are the ways that we disconnect of deeper parts of ourselves. So making ourselves guilty and shaming for parts of ourselves, this is how we learned in developmental stages, and that's of course why it is developmental trauma that we are addressing, how we learned in these stages to maintain a relationship where these parts are not welcomed, are rejected, are threatening for the relationship. And shame is a way of self-rejecting, of making myself wrong for something that is normal, that is healthy, that is natural. Yeah, so when a person in the therapy is naming shame, then there are two things that we usually do. First of all, we make it a process. It's not an emotion, but shame is something that we're doing to ourselves. So this is the process in order to protect the early relationship, like the love relationship to the caregiver. And this is something that we do, that we change this in something that people are doing to themselves. It's not that shame just comes and attacks me, like people are saying, I'm having a shame attack. So there's no thing like shame running around and attacking people. So it's something internally. I'm doing that to myself. I'm shaming myself. In German, we have that expression. Then it's a reflective verb. So in many other languages, it doesn't exist like that, but it is a process. We are doing this to ourselves, and there is a reason why we are doing this. And this is the next thing that we ask. So what is it that you're shaming yourself for? So what's the shaming message that you're sending yourself? And then we can explore. Because when we just try to avoid shame, and many therapists have, well, I heard that very often, so that they are afraid to evoke shame in their clients. And they try not to ask questions or to reflect something back when they think this could evoke shame. But actually, when we do this, we avoid something very important. Because when we address shame and when we make it a subject that we can explore, so then it comes out of this hidden space where it can grow. A shame that is in the obvious, in the light that is explored, diminishes. Shame grows when it's hidden.
So another question. Any input on how NARM might be applied for traumatized foster teenage girls? Is it a good modality for teens who may not exactly want help but need it?
NARM is first of all designed as a model for adults, and but it can, of course, you can adapt it also for teenagers to a certain degree, because you must consider that teenagers are still in a relationship where they are actually depending on their caregivers. So, and this makes it more complex and more complicated. But of course, to meet someone on in a humanistic way, in a relational way, with curiosity and presence, this is something that we can offer for everybody. But how we can address the internal conflicts that we see and that people are presenting, this depends on capacities and also developmental stage.
Thank you. And what needs the therapist to learn to be able to practice NARM?
To trust. To trust, mainly to trust, to be present, and to learn about, well, about the own countertransference impulses. So the crucial part is really the own development, the own process, so that we not get caught up in our own narcissistic issues or our own survival strategies, as we call them in NARM, so that we don't need someone that needs us, for example, when we are very much caught up in the attunement survival strategy, where we are very much attuned to other people's needs and we are very much attuned to what other people are feeling and their suffering, which is, of course, quite common amongst therapists. But then when this is our pride, that we are the one that can provide care and help, then we need people that are depending on us, and that's not a good idea. So this is important, the two things. So to be self-exploration, to be able to explore yourself and to be willing for self-exploration and to grow and to follow all our own narcissistic traits, which I just in general will call that like them. And there can be more open and more covert narcissistic traits. And it's not meant in any way judgmental. This is human, these are human issues. This is normal. This is true for everyone. Yeah? For all of us. Yeah. And to learn to trust that change will happen and I don't have to do something. I don't have to effort so hard for change. Yeah. And I saw this question about are there evidence-based studies about NARM? So far, we don't have evidence-based studies, but we have a lot of experience. And of course, it's always a little bit a thing about this evidence-based studies. When you think about CBT, they have a lot of evidence-based studies. Yeah. But studies, it's a thing with the studies. Yeah. It's I'm not so convinced about studies, I must say. The only studies I really think are valuable are long-term studies. Yeah? And all these short-term studies are really not so reliable. Yeah? Because, of course, you can do studies about extinction of symptoms, and you may be successful, but who knows what happens 5 years later? Yeah? This is not very much explored. Yeah? And there is not a huge interest to know how this goes further on, if this is really life-changing. Yeah? I can only talk about my own experience, and I can only say about what I've seen in so many people, fellows and clients, how they developed over the years, being in the NARM field, being in NARM therapy. And this is so huge because it's transforming. Yeah. And this is not something that happens in between of weeks, but it takes years. And sometimes there are sessions that are like life-changing. Yeah. And this is how development functions. It is like a slowly ongoing process, and sometimes you make big steps in a short moment. And of course, it is maybe necessary and useful, and we're about to think about it, to also implement studies around NARM. But yeah, what is clear and what is examined, you may be familiar with the ACEs studies from the US, the Adverse Childhood Experience studies, and there was also in Germany, they had a big study, because they always do this NARCO study, which is about the health of the citizens of the whole, a bunch of people, let's say, a huge study at least. And they also examined the interplay between childhood trauma and adverse events in childhood and health in later years as adults. And there is a significant interdependence between developmental trauma and health, and also lethality. The more impacted people are, and the more severe trauma and the longer it lasted, the more impact it has on the health of adults. And it's about metabolic diseases, but also cancer and everything. It's really incredible how huge the impact is. So if you have a method that is meant to address actually that, and what I said in the beginning, that we address how clients are organizing their internal world, which means internal world means how they digest whatever comes up for them internally and externally, and to help them to see how they might see the world still through the eyes of a child, and how they still relate to the world as if they were depending on other people, to the degree a child is depending on other people. I don't want to say that we as adults are not depending on other people, but we have much more choice than children. And to help them to gain more freedom in their personal life, and more freedom in how they can relate to themselves, to their internal experience, and also to other people and to their emotions. This is so healing. And of course, when someone is suffering since like 20, 30 years from hypotonus, blood pressure, it doesn't mean that this will vanish in a moment, or if they have problems with their joints, that this is not something we can extinguish, but it might become milder, and the relationship, how they relate to them, to their symptoms and to their suffering, that might change, which also has an impact on our health.
Okay. Can you say something about agency and what role it plays in NARM?
agency is something that we address a lot in NARM, and that's what I mentioned in the example with the shame, that we, as much as possible, we turn the nouns into verbs, and so that the internal process is named as such. When I'm more and more aware that what I experience is related to what I'm doing to myself, what I'm telling myself, how I relate to myself and to other people. So I have an influence of what I'm experiencing. And then when I see that I do this to myself, I at least have the possibility to not do it. It's not just something that happens to me. Like when we say, there is these common examples about shame I already mentioned, but also burnout, when people are saying I'm suffering from burnout. So then we turn that into say, okay, let's explore how you burnt yourself out. Because it's something that we're doing to ourselves. Or when people are talking about, now I hear my inner critic, there is no such thing like an inner critic. This is an image for something that we are doing to ourselves. So tell me more about your criticizing yourself. This is how we use agency. And it's not in order to blame people for their experience. It's the opposite. It's to help them seeing that they're carrying something forward that they didn't start. It's because we all do this to ourselves because we learned at one point in our life that we need to do this in order to maintain a relationship that was necessary for us to maintain in order to survive and in order to maintain a love relationship that we all need as children. We cannot survive without, as a little being, we can't survive without a relationship, without someone taking care of us, and we can't survive without love.
So another question, Beat, being a health coach and not a therapist, how do I use the NARM model with my clients? Is it the higher level of offering trust and present to their story?
Well, I don't know exactly what a health coach's work look like. A health coach is in itself something that sounds more goal-oriented. So if normally you offer coaching sessions, then you have a different setup, actually. And then you might want to change it, but what you can do is actually you can see, as I said in the beginning, the NARM basic principles of how we meet another human being. This is something you can always apply, like being curious, being open, not needing to know, not pretending to know that you know what the other person wants or what they need or how they feel. This is something you can always offer. And for all those who are not in a psychotherapeutic working environment, who are not applying psychotherapy, there is this so-called NARM online basic training. This is open for all health professions, also those who are not explicitly doing psychotherapy, and this is an online training that is offered also to from the Institute, NARM Institute, and it's also available for Europeans because they somehow adapt the timing so that it's not during the night, but it's also streamable, I guess. This is an information that you can get on the website of the NARM Institute. And there is also this NARM Inner Circle. This is also open for everybody, which they offer. Then you have monthly webinars and demo sessions that you can attend.
Thank you, Beat. And how much do you follow the client? How do you intervene? Do you guide also sometimes to become more precise about something that shows up to support understanding?
Yeah, these are very specific questions already. Of course, we not just follow the clients, because well, when clients are used to always tell their story again and again, that doesn't help. So then we want to ask, so what is it that you want? And sometimes we also need to interrupt. So we want to combine, on one hand, of course, this heartfulness and this acceptance for the client's experience and to welcome them in their experience, but we don't want to lose our clarity in that. We still want to be clear, and that also needs sometimes to confront a little bit and to interrupt.
So not being a psychologist, does it make sense to use the model as a stand to do as a psychotherapy? I'm a family doctor, or coming not from psychology, what makes sense in the basic training you just mentioned?
Yeah, as I said, the online basic training, there you will learn the whole concept of the method, the whole understanding, all the organizing principles, but it's not so focused on the clinical application. But you will get a very good foundation of understanding, and then you can see how you can implement that understanding in your work.
Okay, someone else is asking, do you recommend self-therapy with NARM also as a therapist so that you can know how it works in oneself?
Absolutely, yeah, absolutely.
Yeah, and that brings me to someone else that asked, what are the requirements for the training in terms of also supervision and therapy?
The requirements for the training?
Yes, Beat.
In the training or to be admitted to the training?
Perhaps both. That was what are the requirements for the training?
Well, this training addresses, first of all, people who are working in a psychotherapeutic context. Without having any psychotherapeutic work, it will be very difficult. And we had this situation in the earlier years, and all the experience shows that it's not so fruitful for people who are not really working psychotherapeutical and that don't have any psychotherapeutic background. And it's also good to have some psychotherapeutic understanding, to be trained in a method. Because NARM is an advanced clinical model. It's not a model to learn psychotherapy. And in the past, many people used it like that, but this is difficult when you don't have experience in psychotherapy, when you don't have a foundation of an understanding, preferable of psychodynamic understanding, that helps a lot. Then it's very difficult to get really what this method is about. Yeah. And for the supervision and self-experiential sessions are part of the training and are required if you want to have the certificate in the end.
And is attending the introductory workshops before enrolling to the training mandatory?
No, it's not. This is more an offer for you if you want to know more, and this is also open for everybody. Even if you don't want to attend the training, you can still attend the introductory workshop. And if you see that you don't fulfill the requirements for the training, you can also still attend the introductory workshop. And if you're not sure if you're fulfilling the requirements for the training, we are open to have a conversation, and we also do case-to-case decisions. We don't like make it just like on a formal base. So there are always some exceptions. Always people who don't have like this very standard biography. I know that. Yeah. Can be sometimes different.
And to obtain the certification, apart from supervision, therapy, experiential sessions, can you say something about attending the modules?
Yeah, it is required to attend every module and to be part of the small learning groups. So there are practical groups, small groups working where you're coached by an assistant, and you really try out and experiment with the method and to apply the different skills that you will learn, and have your experience with that. And when you're not able to attend a module, you can redo it, you can repeat it in the next training round or in another training, but this is then a case-to-case decision again. And there is also now a video demanded at the end that you will show for supervision, where you do a NARM session with someone, and we don't expect a fully or a complete NARM session, but we want to see if the basic principles are understood.
Just one more question. Does the introductory workshop take place twice at 2 dates, or are there 2 parts of the introductory workshop at the 2 dates? Because we do have 2 days.
Twice an introductory workshop. Very specific questions. Okay.
I think I covered. Yeah, someone.
Thank you. Yeah.
So I think I covered all the questions. So if I missed any question, could you just repost it again, please? Or if something comes up as we come close to the time of the webinar.
I think, yeah, I just want to say also to address that it's always a bit difficult to sum up in such a short time what we do in 20 training days. So it's not so easy. There are many things that I didn't mention, that I didn't address, but hopefully you get some impression of what this is about, and there might be many open questions still left. I understand that. But hopefully you're becoming curious and interested, and maybe you want to attend one of the introductory workshops, and maybe then some things become a bit more clearer, or maybe you're even already decisive in regard to the training. In Portugal, it will be an international training, and I promise you my English will be more fluent then, because then I'm in the mode. At the moment, I'm at home, so that's not so easy for me. But when I'm abroad around with all the assistant team, always speaking English, it's easier.
Okay, I think okay, there's something here in German.
In German, yeah.
that I cannot read it.
Vielen Dank.
Yeah. Okay, so so I will thank you, Beat, for this presentation, and everyone that is present. And I do hope to see you either online for the introduction workshop or in person in Portugal next year. And there's someone else saying that I do have another question. So
yes,
about the training in France.
About the training in France. Okay, very specific.
Will it be translated?
Yes, of course. English, French.
English, French. Okay, to French, yeah. Mm-hmm.
I also speak French, but not good enough to teach it.
Okay, yeah, and also about that, how does it work, the translation? Is it simultaneous?
No, it's consecutive.
Consecutive, okay.
So you will, this is also something which is very good actually, because it slows everything down. So you will have time to digest. When you understand both languages, you can hear it twice. When you don't, you have time to read, to digest, or to just take notes. Very good.
Okay. And also about that, in Portugal, there will be no translations. So the
No
training
translation
will only be in English.
But we will do it slow enough. This is also something which is a very important part that I didn't mention, that it's the slowing down everything. So, because so many things are happening in one moment. Okay.
Okay. So
just the one thing, we will put this online. Yeah, Carla, you mentioned that people can get the video.
Yeah.
But we might also put it online for others to see it if it's not too difficult. But from your